Well, just minutes ago, President-elect Biden said while he's gotten his first dose of the coronavirus vaccine, it will take months to get the rest of the public taken care of. And in the meantime, the pandemic is only getting worse. As CNN's Sarah Murray reports, Dr. Anthony Fauci says it's possible that the new variant spreading in the United Kingdom may already be in the United States.
I want to encourage everyone who has the opportunity to get vaccinated.
The nation's top infectious disease doctor rolling up his sleeve for a dose of the Moderna vaccine today, alongside other prominent members of the Trump administration.
Are you done yet?
Oh, I just got lucky.
That was no problem, people.
While officials are buoyed by the vaccines,
I have complete confidence in the safety and efficacy of these vaccines.
there are still concerns about a strain of the coronavirus that may be more transmissible. The CDC says the UK variant hasn't been identified in the US, but it could already be in the United States without having been detected.
You really need to assume that it's here already.
Even so, administration officials tell CNN the White House is considering requiring travelers from the UK to show proof of a negative COVID test before arriving in the U.S. This as both Pfizer, BioNTech, and Moderna are testing their vaccines against the new strain. And a BioNTech executive tells CNN's Fred Pleiken it's possible to adjust the vaccine to combat this strain.
We should not forget that we have still the opportunity, if required, to adjust the vaccine exactly to this new virus variant, if this is needed.
Vaccines are already rolling out across the U.S., with more than 4.6 million doses shipped and more than 600,000 shots in arms, according to the CDC. While those numbers could be lagging by days, it's clear it will take beyond December to hit the administration's target of getting the first doses to 20 million Americans. Meantime, coronavirus cases in the U.S. continue to climb, now surpassing 18 million.
Our hospitals are overwhelmed in many locations.
Hospitals also under tremendous strain, as the U.S. recorded more than 115,000 hospitalizations Monday, a new record. While officials plead with Americans to stay home for the holidays, there are already signs air travel is picking up, with more than 4 million people flying in the past 4 days.
If you're going to jump in a big metal tube, an aeroplane, with lots of people, so 1 million people every day flying right now, you're going to be sharing a lot of air. People are still getting this wrong, even now. It's the air we share.
Now, we're also learning today that there will be one familiar face that we will not be seeing in the Biden administration, and that is Dr. Deborah Birx. She's telling other news outlets that she plans to retire, that she wants the Biden administration to succeed, and she's happy to help them in any way she can as a civilian.
All right, Sarah Murray, thank you so much for that. Meantime, 44 countries are now restricting travel from the UK because of concerns surrounding the COVID virus strain found there. But so far, the U.S. is not joining that list, allowing for flights between the two countries. I want to bring in CNN's Pete Muntean. Pete, the White House is considering taking action. What are you learning?
Well, Pamela, we know the White House had a task force meeting about this yesterday, and it discussed whether or not to require passengers coming into the United States from the United Kingdom test negative for coronavirus. This will be a first of its kind restriction, although not near as onerous as what some other countries are doing. Canada outright prohibiting flights from the United Kingdom. Dr. Anthony Fauci says we do not need to go that far, at least not just yet. The federal government says it's continuing to monitor this. The FAA says it's looking at it.
So what are airlines doing right now specifically to try to keep passengers safe, given what's going on?
Well, airlines are stepping up in the absence of any new regulations from the federal government. We know that airlines are essentially emulating what the federal government has already discussed. Delta will require passengers test negative for coronavirus before they come in from the United Kingdom. British Airways, Virgin Atlantic also doing the same in an agreement with the state of New York. JFK is where a lot of these flights come into, but flights from the United Kingdom, flights from London, still arriving here at Dulles International Airport.
And quickly, it seems pretty crowded behind you. Lines, what are you seeing?
Well, it really ebbs and flows here, Pamela. We know that the last few days have been really big for air travel, especially leading into this holiday. Friday, Saturday, Sunday, more than 1 million people flew, according to the TSA, nearly 1 million yesterday. It's that 3-day stretch that's so interesting. That is something we have not seen in the pandemic, not even during the Thanksgiving rush.
All right, Pete Muntean, thanks so much. Appreciate it. Now we are joined by emergency physician at Brown University, Dr. Megan Rainey. All right, so I first want to start off the heels of what we just heard from Pete. seeing all these travelers going to the airport, flying, because of course Christmas is right around the corner. And what is your message right now as you see that play out, especially after Thanksgiving and what we saw play out there?
You know, Pamela, I worked in the emergency department last night, and the majority of the patients that I took care of who were sick with COVID got infected over the Thanksgiving holiday. And so seeing those folks traveling just gives me angina. It makes me nervous for what's coming 2 and 3 weeks from now, because we know that most of those folks have not quarantined and have not tested negative prior to traveling. They are spreading virus with them across the country, and they are going to worsen the surge of positive cases, the pressure on our hospitals and on our intensive care units in the weeks to come. And I'm most of all worried that they're going to spread it to their elderly relatives, who I know they're traveling to see because they love, but they could be making this their last Christmas.
So this is really important to hone in on. So the patients you're seeing now, you're learning that they chose to travel, they chose to fly, or whatever, however they chose to travel for Thanksgiving to be with their loved ones, and now they're ending up in intensive care, right?
That's exactly right. That we know that the time period between when you get infected and when you end up sick enough to be hospitalized or in the intensive care unit is about 2 to 3 weeks. So the people that I saw last night almost all got infected over Thanksgiving from family gatherings, from people who had traveled from outside into our state, or from traveling themselves from here to elsewhere. They got infected, they tested positive somewhere around 5 to 7 days later, and then COVID gets to its worst around 7 to 14 days after that positive test. So what we're seeing today came from Thanksgiving, and that travel that you're showing on the screen is going to show up in our hospitals somewhere around the 14th to 21st of January.
So if you would, take us behind the scenes, Dr. Rani. We are seeing the record hospitalizations in this pandemic right now. In California, ICU capacity remains at 0% in about half the state. You're saying it's going to get worse, essentially, because of the holiday and people traveling right now. What are you seeing now behind the scenes? Because you're right in the thick of it, and what are you anticipating?
So what I am seeing is that we are all working as hard as we can. We're calling in backup for sick colleagues. I have a friend just today who just got a positive COVID test. She got vaccinated about a week ago and unfortunately didn't get the vaccine in time to be protected, right? So we're still having sick colleagues. We are having trouble staying staffed. Our ICUs are full. We are all exhausted on the front lines. And meanwhile, my colleagues in California are telling me that they're calling for extra body bags because their ICUs are so full, the death rates are so high that their coroners are running out of room. It is absolutely a system on the edge of the brink of disaster right now.
I'm impressed that you could come on and have it together so well, just given what you've been going through on the front lines there. I want to talk about this new strain. Officials say that this strain that was discovered in the UK is 70% more contagious. Dr. Fauci said it is very possible that it is in the States right now. How worried should we all be about this new strain?
So honestly, I agree with Dr. Fauci. I think the cat is probably already out of the bag. The reports from the UK are saying that they first detected that strain around September 20th. That's 3 months ago. Think about the number of people that have traveled back and forth between the UK and the United States since then. The chance of it not already circulating here is virtually none. And at the end of the day, it reinforces that the best measures we have right now are those very basic public health prevention steps that we've been talking about since the beginning. It's about masking. It's about avoiding indoor get-togethers. It's about, honestly, avoiding travel and about washing your hands and doing all those other basic steps. That strain is already out there. It worries me, but it's just we got to stick with those very basic things in order to make it through this winter.
Absolutely. And as we know, some are getting vaccinated right now. Folks like you who are on the front lines. Pfizer and Moderna are both now testing this strain and how it responds to their vaccines. But they have said that they actually think their vaccine will be effective against this strain. If you would walk us through how this is different than the flu shot, where you have different strains and sometimes the flu shot isn't as effective some years.
Absolutely. So the difference here is a couple of things. One is we don't fully know that that the vaccines are going to be fully effective against this strain, but everything that we know so far suggests that it will, because the mutations that we're seeing are very slight and are not enough to change your body's immune response to the vaccine. The second part is that the flu vaccine usually stays effective for the majority of a year, but we have that antigenic shift. We have those mutations over the course of a year that require a new vaccine the following year. Most of us are expecting at this point that COVID is going to shift over time. We're seeing enough mutations that we think that we will have to change the vaccine a little, but probably every 2 to 3 years rather than every single year. It's just a different virus and it works a little differently. The last thing is that this is the really exciting part about the mRNA. Because it produces a specific part of the virus that the body mounts a very strong immune response to, those minor differences, those minor mutations are less likely to make the vaccine totally ineffective than vaccines like the flu vaccine that are based on the entire virus.